Namaskar. I am Dr. Chanda Chowdhury, consultant gynecologist and obstetrician in Manipal Hospital. I am managing high-risk pregnancy, infertility, and I am also performing different type of laparoscopic, hysteroscopic, and robotic surgery. Today, I am here to give some information in day-to-day life of our women, that is pelvic pain. Pelvic pain in the form of endometriosis affecting the reproductive health of the women from the puberty as early as 10 to 11 years to 50 to 55 years. Sometimes we neglect this pain. We think it is common, so we don't treat, we don't go to a doctor. We think over the counter medicine it will help, it is physiological, mostly in adolescent. So our mother, teacher, our peer, everyone has to be aware about this disease. Here I am giving you some information so that it will help you to diagnose the disease, to prevent its progression, help in fertility, and prevent chronic pelvic pain, overall improving mental and physical health. Nowadays, 10 to 15% of cases of pelvic pain is mostly caused by the endometriosis. Now come, what is endometriosis? Endometriosis is a female disease where endometrial lining, that is the endometrium, when it grows outside the uterus, within the uterine cavity, within the uterine muscle, then we tell is adenomyosis. On the fallopian tubes, on the ovaries, then we call it chocolate cyst or endometrioma, and between the uterus and gut, between the uterus and bladder, sometimes it is found in the scar tissue, then we call it scar endometriosis, in the lung and also in different places. So coming to causes, why it happened? Mostly there are some theory. When the period starts, then the uterine blood backflow into the abdomen or in tummy, and if it persists, then every time during period it may cause pain. Or it may be genetic, that your mom, your aunt, your grandmom had the same type of symptoms, then you can also have this type of symptoms. And some are called immunological. Overall, what I can say, if we do regular exercise, we have proper diet, if we go to doctor and diagnose or pick up the disease early, it can be managed early. Now coming to symptoms, how patient presents or come to us. Pelvic pain. What is pelvic pain? Pain before and during menstruation. And this pain usually progressive, means every month this pain increases. Sometimes this pain may persist in whole month, and if it is more than 6 months, then we call this chronic pelvic pain. Patient also present with pain during menstruation, during passing stool, in menstrual period time, and sometimes the pain may radiate from back to leg. Pain during sex and after sex, and also mostly fertility issue and overall mental health affection. Now, how can we diagnose? In diagnosis, you must need to come to doctor. They will examine you. They will do an internal examination, that is called vaginal examination. What doctor do at that time? Doctor try to feel if there is any pain or tenderness in your vagina or cervix, and After then, no blood test is actually confirmatory for diagnosing it. Next is ultrasound, that is internal ultrasound, transvaginal ultrasound. This also not conclusive. Then what next? Then is the MRI, and it is the contrast MRI, very much helpful in picking up the complex and extensive endometriosis. And sometimes the test or examination I told, then the next is the laparoscopy. Laparoscopy not only help us seeing the disease, it also help us treating the disease at the same time. And coming to treatment, so many drugs are available. The analgesic drug in the form of paracetamol, ibuprofen, these are over-the-counter medication. You can try the medicine. If they don't work, then doctor prescribes some hormone in the form of oral contraceptive pill, the progestogen in oral form, in injectable form, or intrauterine device. We called it Mirena. Okay, and if someone cannot take those, or they have no option for this medicine, then we suggest for them to go for laparoscopy. And by laparoscopy, usually if there is any cyst, we take it out. At the same time, if there is pelvic disease, we take the biopsy for its final confirmation. And when there are some issue that cannot be also tackled by the laparoscopy, in treating endometriosis, laparoscopy not only help us diagnosing the disease, at the same time we treat the disease. And when there are extensive disease, now there is the robot help us in extensive and deep infiltrating endometriosis treatment. This all, I hope this will give all our women suffering from pain at least some information that they will go to doctor and take the right decision and right treatment. Thank you.